Thank you, Deputy Speaker. And it is important to be here speaking on these bills at a time where our government knows that Australians are looking to us for support, are looking to our government to steer our country through some difficult economic circumstances, and understand that in crafting the budget that we have put together, we are putting cost of living relief front of mind, while also behaving as a responsible government should do in circumstances where we do see inflation rising and where we do know that we have to be responsible economic managers setting our country up for the long term. And that is certainly very much what this budget is designed to do. And I know from speaking to people in my community that it very much addresses the concerns that many in our community have. It does provide cost of living relief in some really important areas, particularly it invests in our health system. And it invests in our health system at a time when we know our primary health system, our GPs, our local clinics, have been close to breaking. Because what we've had until this point was a Liberal National Government that neglected our health system, a Liberal National Government that seemed to think that Medicare didn't need investment, that the fundamental piece that holds up our health system, that means that we have a universal system where healthcare is accessible to all. The previous Liberal National Government did not invest in that system. And in my community and in communities around Australia, we have been seeing the impact of that underinvestment. In fact, I recently ran a community survey in my community asking people to share their views with me on their priorities and, in particular, their experiences with healthcare. And I had nearly 1,000 people send back responses to that survey, and I thank everyone who took the time to share with me what's going on for them and what their priorities were. A very key theme that came from that survey was both how our community values our healthcare workers, the doctors, nurses, the support staff who do so much, but also how they realise how the system is just stretched. One of the key themes was around local health services. And Miriam from Bundoora told me the cost of seeing a doctor has gone up a lot and it's harder to access bulk billing now. Ivan from McLeod told me, I've been going to a local clinic that bulk bills, but from 1 July they'll stop that. So it will become more expensive to access healthcare because out-of-pocket expenses will increase. Meredith from Ivanhoe told me it's nigh on impossible to get an appointment with my preferred GP. And Gail and Brian from Research said the wait for healthcare is too long. Local GPs are now too expensive and we can't get in for appointments for at least 3 weeks in advance. Well, I'm really pleased to be able to say to all of those people and the others who brought up healthcare with me in that survey, our government has listened. Our government knows that this is a priority area that we have to invest in, and we have invested in this budget. So I'm very proud that our government is making a historic $5.7 billion investment to strengthen Medicare in this budget. We have heard the concerns of patients, of doctors, and we are doing something about it. Our government is tripling bulk billing incentives. This will make it easier and cheaper for people to see a doctor. It will support GPs in my community and communities around Australia to bulk bill, and in my community it means around 63,000 eligible people right across Jagga Jagga will have better access to bulk billing. That is a huge difference when we think about the importance of people being able to see a doctor when and where they need it. I was pleased recently to be able to talk with some of our local health providers about the impact this will have. On International Nurses Day recently, I visited Eltham Ridge Medical Centre with my friend, the Assistant Minister for Health and Aged Care. And we were there to thank the nurses and all the staff who keep that very busy clinic running. But it was a great opportunity to not only thank them for the work they do, but also to talk with them about how important this investment our government is making in bulk billing will make. Having that bulk billing incentive tripled will make a difference to them in their practice and will make a difference to the number of locals who they are able to bulk bill. It will provide relief to ensure that the centre keeps going, that it can provide the essential services, that it can provide bulk billing services, and I know that that support will not just be there at the Eltham Ridge Medical Centre, but it will be there at GP clinics across Jagga Jagga, and I'm very pleased about that. Of course, on top of the huge investment we're making in bulk billing, we're also making medicines cheaper. And an estimated 38,710 people in Jagga Jagga alone will be able to buy months' worth of medicines for the price of a single prescription for 300 common PBS medicines. This is going to halve the visits needed to GPs and pharmacists, again taking pressure off our GPs, and saving people up to $180 a year on every eligible medicine they buy. In total, this will save Australians $1.6 billion. And we've been very clear as a government that the savings that the government makes from this measure, we will be putting into community pharmacies. We do value our community pharmacies. We will be reinvesting in them so that they can deliver more services. The final part of the health package that I would like to emphasise that our government's been really working on is vaping, which I know has been a huge concern, particularly for many parents and teachers in my community who have raised with me their concerns seeing young people taking up vaping and their concerns about what that means for their future when they're taking this up and not realising the potential impact on their health and the dangers. Our government has now committed $733 million to tackling the challenges we're seeing with both vaping and smoking. And our priority is protecting people, particularly young people, from the harms these cause. So we're working with states and territories to stamp out the growing black market in vaping by introducing stronger regulation and enforcement. Across these measures, it is really clear that health is front and centre of our budget. Our government values the health of people in our community. We value Medicare. We will always protect and strengthen Medicare. We are putting your healthcare, putting the healthcare of people in my community front and centre in this budget, and I'm really pleased and proud and looking forward to seeing the impact that will have on people in my local community. Deputy Speaker, our government recognises that cleaner energy is cheaper energy. And again, what a transformation from what we've had over the past decade. To realise that the future in our country is renewable. And again, when I go around my community, absolutely people understand this. They are looking and have been looking for quite some time about what they can do to make that switch to renewable. And our government has seen that that's an area where we can support people, that we can take action to support households with energy-saving upgrades, $1.6 billion being deployed for energy-saving upgrades for homes, businesses and social housing, helping people in my community and in others, those who have older appliances or homes that they need to upgrade, to make sure that they are getting these upgrades that lead to more energy efficiency savings. Our government's Household Energy Upgrades Fund will turbocharge financing options for upgrades by partnering with banks and other lenders on upgrading homes with battery-ready solar, modern appliances and other improvements that will help keep energy costs down. 110,000 households will benefit from lower energy bills under this initiative. And we're setting aside $300 million to support upgrades to social housing, recognising that social housing, a lot of the stock was built before minimum standards were put in place, and it is absolutely important that people in social housing get the benefits of those upgrades to energy-efficient appliances. Once implemented, 60,000 properties a year will save up to 1/3 of their energy consumption each year. We've also put in place a dedicated fund for small businesses with an annual turnover of less than $50 million a year will be provided an additional 20% deduction on spending that supports electrification and more efficient use of energy. And this will help up to 3.8 million small and medium-sized businesses with ongoing energy savings. Deputy Speaker, our government is prepared to take a leadership role in this space. We have transformed our country's approach to tackling climate change. We have recognised that we need to make the investments that set us up as a future, not just to be a renewable energy superpower, the potential for our country there, but also the potential for all households, including households in my community, to benefit from a renewable energy future. And we are doing that work at a national level, but we're doing it at a local and household level as well. And again, I know that that investment will be warmly welcomed in my community. Deputy Speaker, in the time left to me, I would also like to talk about our government's investment in the environment. My community in Jagga Jagga is a beautiful part of the world. Are we done?
It's continue. It's just, with the indulgence of the Federation Chamber, we'll let the member for Jagga Jagga finish her remarks.
Thank you, Deputy Speaker. I appreciate that. I'll be brief. My community in Jagga Jagga is a beautiful part of the world. We're surrounded by trees. We value our natural environment, and indeed I know many people around Australia do so. And that's why I'm pleased that our government is also investing in the environment. Locally, we are investing in our local rivers with grants to help support local efforts to clean them up and protect them. But nationally as well, we are investing in national parks, an area that has been long neglected, but which I know, again, people from my community love to visit and enjoy around Australia. We're taking the long-term investments that mean that these places will be protected for us to visit time and time again. So I commend this bill to the House and look forward to seeing the benefits of this flow through my community.